when I was wrapping up my undergrad, and the PA profession at the time, I just kept coming back to it. It felt like it checked all the boxes. It was my chance to practice medicine.
If you are trying to decide whether the PA profession is right for you, this episode will give you real insight. Today I am joined by Allie Penrose, a graduate of Dalhousie's inaugural MPAS class. Welcome to the Canadian PA podcast.
My name's Allie Penrose. I'm from Halifax, Nova Scotia, born and raised. I actually am finished the Dalhousie PA program. It's a 2-year program and I think it's the only one that starts in January. So I did my undergrad at Acadia University in biology and psychology, the neuroscience stream. And I knew I really wanted to be in healthcare in some capacity, but I wasn't really sure what. So I decided to work at the QE2 for a couple of years in a few niche roles in healthcare, which I'm sure we'll chat about later as well. And then Dal announced the program, and it felt like the perfect timing for me to switch it up and start my career as a PA.
For those of us that aren't familiar with QE2, what is that?
Yeah, that's the hospital here, like the main hospital here in Halifax, Nova Scotia.
And you're originally a Halifax native?
I am, yeah.
What's it like growing up there?
I love Halifax so much. The people are amazing. It's like small town vibe. I just find the culture here is so incredible. And I knew that I wanted to stay here. So when Dal announced the program, it just felt like it was all like falling together.
How did you first come across the PA profession?
I knew I wanted to be in healthcare in some capacity, but I just did what I think a lot of us did, research pretty much every single career that there could be, not really feeling like I needed to do like medical school, but something along those lines. So I looked up like RT, anesthesia assistant, psychologist, like really did a deep dive in all the careers. So this would have been back in 2017 when I was wrapping up my undergrad. And the PA profession at the time, I just kept coming back to it. It felt like it checked all the boxes. It was my chance to practice medicine, but also get a variety of different things because I'm so interested in so many different facets of medicine. So that during my research then in 2017, I just really clicked. But there was no PAs practicing in Nova Scotia. At that time, the trial here of the ortho PAs hadn't even happened. So I was worried to go to a school in Ontario or somewhere else and start that path and then never be able to come home kind of thing. So I just kept a pin in it and then kept thinking about it while I was doing other things.
You mentioned that there were a lot of checkboxes that PA fit for you. What specifically about it drew you to the profession?
I've always had this desire to work in healthcare, wellness, and healthy lifestyle has always been such a big part of who I am. So I knew that that was the path for me. But then with the PA profession itself, I knew it was my chance to practice medicine, like challenge myself intellectually. Also, a huge part for me was the lateral mobility that everyone talks about. It's like the key words we use when we think of the PA profession. The flexibility, because I'm so scared to commit to one specific area of medicine. I wanted to be able to switch up specialties if I wanted to, maybe do a couple specialties at once. So that was the big thing for me. And I knew I wanted to be patient facing. Any interactions I had with people were what really resonated with me during my undergrad and during some of my other careers. It was the patient facing that was the most rewarding part of my prior experiences. I don't know, just those things were the main things, and it all felt like the PA profession was lining up with all of that.
Can you give us a little bit of background on how you were able to determine that it was the best for you?
I took the time to actually really reflect, because when you're in undergrad, I think a lot of us feel like overwhelmed with the options, especially when you do science degree, but you're not really going to go to medicine. You're like in your head about all of the different ways you could go. So I did a lot of journaling. I had to really sit down and think, what are the things that are important to me? And that being variety and the things I could practice in the PA profession with the lateral mobility, the patient-facing aspect of it. And then from there, I also did reach out to people within the different disciplines. Anyone I knew that was an RT or an what their day-to-day was like. I did a lot of research. I did, like I said, a deep dive, and then I would go in one direction and then almost commit, but then be like, it just doesn't feel quite right kind of thing. So I think the biggest thing for me was actually really taking the time to sit down, reflect, journal, and keep those values in my mind as I was going through each profession.
And when reaching out to those different disciplines, a lot of PAs are not connected directly with healthcare providers. So how did you get those opportunities? Was it an informational interview, or was it more shadowing that you had gotten?
Before I started my job in the hospital, it was really just like research online. And then if I knew friend of a friend kind of thing, it was pretty informal that way, reaching out to people, trying to connect me, or like any resources I had through my university, Acadia University. Yeah, a little bit of an informal way to reach out to people. But then I thought, what if I got a job in healthcare? That way I can see like firsthand how these professions work and what the day-to-day is, make a lot of connections that way, and then really start to figure out my path. So really shortly after I graduated Acadia, I got a very niche role in the hospital, and it allowed me to meet a lot of people that way.
Fantastic. So it was through networking and building relationships through jobs or placements that you had.
Yeah.
And how important would you say that understanding different roles and understanding PA role is prior to applying to the PA program?
Yeah, that's really huge. I think that it was such a important part for me, and I think it is one of the things that I'm hoping showed in my interviews and in the whole application process, because I was so thoroughly researched and tried to reach out to anyone I possibly could. I think the PA profession is still so misunderstood in some ways, or not really, like people don't really know what it is, and I think it's so important to know exactly what you're signing up for and make sure it is what you want, because I think the last thing you want is just to choose PA because why not, or choose PA because you think medicine's too long, those kind of things. There's not really the right reasons. It's more like making sure the ins and outs of exactly what it is that the profession will be. So I think that's like such an important part of it.
It sounded like you had a very self-reflective journey and you were very insightful on the reasons of why you wanted to apply. I'm sure it was able to shine during your interviews. So yeah, the reason why I ask that question is often sometimes when I'm speaking to pre-PA students, they don't actually have an understanding of what a PA is. I know that speaking with most patients, I know most people know what a nurse and a doctor is. For providers that aren't as well known, midwives, physician assistants, advanced practice physios, nurse practitioners, the awareness is getting better over time as the number of those types of practitioners increase. But was it ever a deterrent for you that PA wasn't as well known or not as well established within Nova Scotia?
I don't think so, which is interesting because like in second year, especially when you're like the first PA in Nova Scotia, there's very few PAs. We're growing all the time, but you're really the first interaction that anyone has had with it. So you really have to be like ready to advocate, ready to educate, and stand up for the profession. It never really was a deterrent for me. It was more like, okay, let's put on the advocacy hat and let's like show everyone how amazing we can be as part of the team.
So it sounds like you're almost drawn to that aspect of helping to pioneer the profession.
Yes, definitely.
Okay, wonderful. I think we're really lucky that we have someone like you pursuing the profession and being an advocate on our behalf.
Yeah.
So I wanted to pivot to your experience as a pre-PA, because I know a lot of people are very curious about this. I know that you had mentioned a few things before, but can you just break down some of your pre-PA stats in terms of your undergrad, healthcare experience, and any other admission requirements that you think might be helpful to know?
Every PA program, you need an undergrad. It's helpful if you have some science background. Prerequisites for Dalhousie specifically were anatomy and physiology and biochemistry. So I had those as part of my undergrad. And then as far as stats, I was just actually reviewing the Dalhousie application website because it does change every year. So if anyone is listening to this thinking of joining the Dal program, I would advise you to go to that website just to make sure you're up to date on everything. But for me, it was at least a 3.0 GPA, with 3.7 being the more competitive. So my GPA was 3.8 on a 4. This is on a 4.0 scale. And then there was no healthcare hour requirements as part of Dalhousie to get in, but I felt like I myself started in 2017, and then the program didn't start until 2024. So I had 6 years of experience, and I felt like that was a huge help in my application process. I think it really taught me a lot, and I was able to like call on that experience. I was able to tie in relationships and shadowing that I had done with that career and really show that I had that experience as part of the interview and the application process. But healthcare hours are not required. Everyone brings their own strengths. So I had that. And then as far as the other things required in the application process, we had to write a personal statement. And then there were some short answer supplemental questions on how you would handle certain patient interactions and that kind of thing. And then Dal has 24 seats, mostly saved for Nova Scotians, but 3 for New Brunswick and 1 for PEI.
Okay. So I know one of the requirements is you have to be a resident of the Atlantic to even be considered for applying, which is interesting. Why do you think they have that requirement?
I think they have that requirement as a way to retain people. I think they would and that's the only thing I could really think. They wouldn't want a lot of people going from outside and then going back to Ontario or Calgary and leaving Nova Scotia. So that's what I was thinking. But
Yeah, I guess admitting locals or people that have lived there, they're more likely to go back to the communities they grew up in. You had mentioned that you had 6 years. So what your, I guess, communication skills and your ability to problem solve, critically think, very different at the end of undergrad versus where you were after 6 years. Can you describe some of the jobs that you had and how you found those opportunities?
I graduated in 2017, and at that point in time, I was just like, get me in the healthcare field in some way. And then from there, I'll make a lot of connections. I'll be able to see how people practice day to day and weave my own path. So I started in a very niche role in organ and tissue donation at the regional tissue bank at the local hospital here in Halifax. And in that role, we were responsible for screening donors after they had passed away for eligibility. So going through their medical chart, talking to the medical team, speaking with loved ones about their medical history to ensure that they were suitable for donating their tissues. And then along with that, we would fly out in the Atlantic provinces for organ donation, which is perfusion support for that. So that role specifically, very, very niche. A lot of emotional intelligence and resilience because it was very tough to speak with families so soon after they had lost their loved one. But it was a beautiful thing to be able to offer them that gift of donation at such a sad time. So a lot of that side of things, as well as surgical experience. So we would go in the OR and actually surgically retrieve the tissues and assist in the organ ORs as well. So I picked all the things I love the most of that job, which was the hands-on surgical skills, as well as that connection that I would have with patient families. And I also had a role for it was connected to that laboratory here at the hospital in cell therapy and stem cell transplant. So I would process human stem cells and cell therapy products like CAR T products for transplant for people with blood cancers. And then I would be able to go to the patient room and be part of the transplant process where they got their magic cells that would help cure them of the cancer. So again, in that role, that specific patient interaction and that emotional connection I had with the patient was the best part for me.
Yeah, that sounds like amazing experience. How did was there a lot of prior experience required in order to apply for and get those jobs?
Yes and no. They definitely wanted the undergrad, but then straight from my undergrad, I got into the tissue bank. And because it's such a niche role, there's not really a program you can do in advance. It's an 8-month on the job training. So I feel for that one, I just got really lucky in my application process. I had some good references from my school to get in in the first place. I don't think they hire a lot of people right out of school. Usually they do want some healthcare experience, but I got lucky with that one. And then otherwise, again, I was just able to make those connections with hospital and move into that cell therapy role as well.
Excellent. And what are some of the previous healthcare experiences or undergrads of your classmates?
Yeah, we had a very wide variety. A good amount came straight out of undergrad. And like I said, everyone has their own strengths. So don't feel just someone's watching this trying to decide whether to join PA. Don't feel overwhelmed or just coming right out of undergrad is not enough because they brought so much of their own strength with just the really great study skills and kind of fresh studying, and a lot of that science is very in their mind still. But anyway, yeah, a lot of people came right out of university. We had a couple paramedics, we had a respiratory therapist, a physio, and someone who worked in the pharmacy. So a lot of different paths.
Anybody with just an undergrad background that didn't necessarily have a paid healthcare experience?
Yes, definitely almost half of our, I would say 8 people maybe of the 24 of our class came right from their undergrad. And I think they had a lot of volunteering or had some like part-time gigs on the weekend to get their foot in the door for healthcare. But again, like I said, healthcare experience is not required to get into the DAL program. So I don't think that should deter you from trying to apply if you're right out of undergrad.
And do you have any suggestions for students that may not have strong healthcare experience on how they can find those types of?
Yeah, I can speak for Halifax, Nova Scotia. I don't really know if it would be the exact same elsewhere. But for me, networking is actually quite easy in Halifax, I find, because it's so small. It's really easy to make those connections. So depending on what resources your undergrad university has, Acadia had a lot of good like networking opportunities, that kind of thing. I find people are really open to shadowing. So I was lucky in that I did get my foot in the door in a healthcare position, but then from there, I did so much shadowing that kind of was to help me get better at the job I was doing, but also not required at all with the donation program. Like I would go to the OR to see a lot of the ortho surgery so that I could better understand. And this is me just going out of my way to find people to say, would you mind if I come observe, because it would help me. Or a lot, also part of the tissue donation is corneas. So I would go to see some like ocular surgeries as well. Again, not required, but really people are so open to having you just come and observe. So if you can find someone within the hospital that can connect you with maybe a certain specialty that you're interested in. People are so open to having learners or even just people that are just trying to get like a sense for what the day-to-day is, because it's so hard to really know what something like a job is really like until you see it. I don't know if that helps the actual specifics. And if anyone in Halifax, I'm sure at some point here I can share my email. People can reach out to me because I have a lot of connections within the hospital. But yeah, if you can, even if it's like not a paid job or it's not official volunteering, if you can try to reach out to someone and just say, can I come in and shadow you? I think that would really help.
Yeah, I'm coming from a place of genuine interest. I think a lot of pre-PA students sometimes fixate on trying to obtain shadowing from a PA, but shadowing anybody within the healthcare system is important. I think because of understanding the scope of practice of different providers that you may potentially work with as a future PA is so invaluable.
Great, yeah.
Now, going back to the application process. So I like to compare applying to PA school a lot like having a part-time job. There's a lot of different moving parts and deadlines. How did you stay organized and on top of everything without getting overwhelmed during the application process?
It's funny because it was such a blur for me. It was so hectic, just the fast-paced nature of it. And I think it was a little specific to our class because Dal had announced the program in August of 2023, and it came out of nowhere. I had a job at that point, and I hadn't really been thinking about PA that much anymore. So I was like, oh my gosh, like this is my opportunity. I got to do it. But they announced the program in August. Applications went out the next month. And then part 2 of the applications, which was the short answer, was like a couple weeks later. They immediately told us about interviews in October, and then the final decisions were all in November. So it was such a short amount of time. I think it's a little bit more spread out now, but I just didn't have time to overthink it because I was like, let's just do it. I just made sure to like really schedule in time to prepare for each part. A lot of the personal statement was more so just getting out like all of the reasons why I wanted to be a PA. And I think also a really important part for me is that I was from Nova Scotia, and I made it very clear that I wanted to stay in Nova Scotia and help the healthcare system here. But yeah, as far as staying organized, I scheduled things like in my calendar every single day. I would leave my job and work on perfecting certain parts of my application, hoping that I would get an MMI interview. I started researching that and practicing MMI questions like as much as I could, but it was very quick and very hectic. So it was hard.
Fast and furious, just like PA school.
Exactly. It was my first taste of what it was going to be like.
Yeah, sometimes I think that if the deadlines are really dragged out, it's almost a bit more torturous. You're stressed for a lot longer because of the uncertainty and just waiting to get those things done. Are they still doing a January start for Dalhousie?
It's still January start. I think, like I said, the application process is a little different now as far as timelines. And I do believe they plan to change it to a September start just because every other program at Dalhousie is a September start. And from what I understand, every other PA program in Canada, I think, is a September start. So we're a little like strange in our timeline there. So I think the plan is to initially shift to that, but they're still January for now. Yeah.
Yeah, there was a point in time where U of T actually, I think they graduated their students in January
Okay.
and McMaster was in September. There was a little bit of a disconnect with regards to the jobs, the career start, and when people were able to apply for jobs and start working. So it's good that they were able to match it up. But because Nova Scotia and the Atlantic is a very particular area, I don't think you're really competing with other graduates from other programs necessarily for the spots that are there in the Atlantic. So you had mentioned that you were practicing MMI questions. Can you tell us a little bit, without, of course, divulging like conflict of interest issues with the program, but what was the MMI like? What was your understanding? How did you prepare?
Yeah, that was like by far for sure the most daunting part for me. I find interviews very challenging. I think because I knew interviews were challenging, I tried to do as many as I could, like not even knowing I was going to do PA school, but I was trying to get better at them. Even interviewing for the first job that I got in the hospital, thinking that there was no way I was going to get it, but putting myself in those uncomfortable situations because being comfortable with the uncomfortable is like the whole motto of me in PA school. Like everything is challenging, but yeah, putting myself in those situations, interviewing for jobs and switching it up to be more comfortable. So just as far as prep in advance, just having that interview experience, I think really helped me. Ours was in person, which I think I preferred. So yeah, as far as my expectations and preparations, like I said, I like to be very prepared, but knowing that MMI, you can't like really know what they're going to ask. So I just tried to find as many practice questions as I possibly could, researching and making sure that they were Canadian resources. I think McGill, maybe McMaster, a lot of like practice MMI. So it's more just like getting in that habit of being comfortable with those types of questions, knowing that you can't come rehearsed with the exact like, which they don't want. It's the whole point of an MMI. You're never going to know every single thing they're going to ask and how to perfectly answer it, which is uncomfortable, but that's just the way it is. So really just getting in the habit, like practicing, watching YouTube videos, the different MMI practice attempts too was really helpful.
And when you say practice, were you recording yourself and watching the playback, or were you practicing with a friend or family member?
I was doing both. I would practice with my partner and just give him the list of the MMI questions I found online and get used to saying them out loud. It was more that, I think, practicing with him, but I did record myself a few times and pick up on parts where I wanted to like fix a bit and that kind of thing. And I also got a book, which I think you have some resources on your website too of suggested books, but I got a book that had a lot of practice questions and like tips and tricks thing too.
So that was really helpful for you. That's good.
Yeah.
Now, the day of, was this a whole day affair? Did it take up the entire morning? And meeting your potential future classmates must have been intimidating too.
Yes, the whole thing was so intimidating. Like I said, that was almost better because we didn't have time to think about it much. Like we got announced that there was interviews in 2 weeks and it's just happening in 2 weeks. If that was dragged on, it would have been even worse. But it was, I think, I can't really remember now. I think of maybe a 2 or 3 hour chunk. We were in different groups. So I was with maybe 20 other classmates. And there was a little intro session on like what PAs are, how the MMI is going to work. That was painful because you were sitting there for almost an hour, just like shaking in anticipation for the interviews themselves. But so I got to briefly say hi to people and meet them, but at the same time you're in your head. Then I think it was 12 stations in person. I think they're now online through Dal, but it all went by so quickly. And it's hard to know really how exactly you did in an MMI, I find. Like, I just kind of left being like, I did the best I could and we'll leave it at that.
Would you say that you managed your stress well, or what did you do to combat that feeling?
Yes and no. I think I knew going in that I was going to like that kind of thing. Public speaking or interviews are really like a challenge for me. They make me really uncomfortable. So I think going in, I had to like really tell myself that every room is a new start, which everyone tells you going into an MMI, but you really got to stick with that. And if you have a room where there's a question where you didn't really feel like you hit the nail on the head, you kind of have to just take a deep breath. I did some breathing exercises in the hallway and I was like, start fresh, you know what I mean? So I think that's the best. And leading up to it, like I said, just telling myself that I've done everything I can to prepare for this. At this point, it's just like, what's going to happen is going to happen.
Fair enough. There are a lot of students that may not have a higher GPA. So I know the average tends to be a little bit higher towards 3.7. You had mentioned you had 3.8, but I know that the range of those that get accepted is a bit wider. So can you speak to how important GPA is in terms of the success rate of getting in, or do you feel like there are other factors that are more important?
Yeah, definitely other factors. I will say the Dal website itself does say that 3.7 makes you more competitive, but everyone has their own unique experiences. And I think that it's the whole picture. Like I said, 3.0 on a 4.0 scale gets you in to be considered. And then I think the most important part of the application process is really like focusing on what makes you unique, because everyone's going to have a pretty good GPA. Everyone's going to have that volunteer experience, maybe a little bit of healthcare experience. But if you can really focus in on like your why, I say, your real reason of why you want to do the profession, and it's very clear you understand the profession, it's very clear that this is the route you want to take. And then again, focus on that unique part that makes you different than someone else. I think that's just as important. And you might in your head think it needs to be healthcare related, but it could be unique in any way. Like you're a competitive athlete in a certain sport. That kind of thing makes you so unique, and it brings different values. So don't worry, like definitely apply no matter what, I would say. And don't really try to focus on the GPA, because that's such a one part of such a big background and experience.
Now, I wanted to move on to the next part. So, what your experience was like at the Dalhousie program. So, can you give us a quick overview of what's involved in the education?
So, I think it's similar to a lot of PA programs, but as they were forming it, they spoke with the other PA programs in Canada and came up with their own style. So it's 24 students every year, and it's a January to January program. So we finished up, we're the first class, and we finished up in December 2025. And then as far as the setup, like I said, similar to other programs, in that first year is all didactic learning, with the key courses being medical foundations, which at Dalhousie is very case-based. So it will be a case. The first unit was cardiology, so it would be a case on something in the cardiology field, and a lot of questions you had to answer that went into like clinical presentation, pathophysiology, anatomy, management, complications, all that kind of thing within that case, and you work in small groups. So that's a very key part of the DAL program. Then we had skilled clinician that a lot of schools have as well, which is more the hands-on skills, the practicing, history taking, physicals, your OSCEs. And then we had professional competencies, which was an ethics and communications class. And we also have a research component that's done in groups at Dalhousie. So you're helped to find a mentor, and then you do a research project with that mentor, and then anatomy and physiology labs. We did some classroom lectures and then also cadaver labs. So those are the key components of first year. And then second year is all clerkship from January to December, with those key parts of medicine probably being very similar to other programs in Canada.
So what were some of the rotations or specialties that you did, core and elective?
Yeah, so the rotations, it varied as far as length. We spent 8 weeks doing family medicine, pediatrics, psychiatry, obstetrics and gynecology, internal medicine, surgery, and emergency. I think that's all the core rotations. And then you got 2 electives that were each 4 weeks. So I did hematology. I had connections from my other cell therapy stem cell position. I knew the team there, and they had a really good collaborative team. So I did 4 weeks in hematology, and then I did 4 weeks in dermatology.
Now, before you did clerkship, what specialties were you drawn to, or what did you think with this?
I was someone who was so interested in so many different fields that it was so hard for me to decide. Going in, I thought I would really want to do surgery because I had that kind of surgery style background. So I really knew I was going to that one. I really thought I would like psychiatry as well. And then I was excited for my elective in hematology because I knew the team and I could see the fit of a PA on that team as well. So those were the ones that I was really excited for, but I can't even express, I loved every single rotation so much. I would be in the middle of a rotation and text my classmates, my friends, being like, okay, I'm doing this. And then the next week I'd be in a different, and I'd be like, no, I'm doing pediatrics. I just really liked everything, which I think is a good thing, but it makes it hard to decide in the end, where you want to go.
Yeah, and what's nice is that you don't have to decide necessarily.
Exactly.
being a student or medical learner is very different than what it's like actually practicing. So I'm glad you got exposure to all of those different areas. Now, for first year, just moving back to that, what would you say was the most challenging part?
Yeah, I think if I were to break it up into like generally being a PA in any program, I'm assuming first year was just really getting used to that pace. Everything is so fast and it's very easy to become overwhelmed. I think also in my mind, I'm very much a perfectionist and I just really wanted to understand every single concept in such depth that the time just simply didn't allow for. So it was really hard for me to turn off that switch of studying. I would leave class and I would just go home and study because I wanted to like really know everything. But then I burn myself out really quick in first semester just because there was no one telling me like you have to stop, now's the time to stop. It was just I have to study, I have to study. I can't go do social things because I need to like cram all this information in my head. I got a lot better as like the semesters went on at time managing and realizing like burning myself out is not gonna help anyone. It's not gonna really, I'm not learning that much more. I'm just feeling guilty for not studying. So the pace and trying to understand that perfection, like perfect isn't always attainable. That was the hardest thing for first year for me. And then for Dal specifically, because it was a brand new program, there was a lot of challenges with that. Like a lot of the content they had adapted and borrowed from the medical school. So a lot of it was the cases we did, a lot of them were almost identical to what medical students were doing. So they were really in depth and it was hard for us to gauge like how much do we need to know versus the medical students and like finding that line. So with that content kind of being created in real time, it was that was a little hectic at the start as well. But like I said, as the year goes on, you get your groove.
Yeah, that sounds very much like the experience that I had with Mac. And I think establishing any new program, they work out the kinks, but subsequent applicants will get the benefit of feedback from previous students. So I'm sure they have a little bit more solid hold on handle on their curriculum now. So you had mentioned that you were just studying so excessively, and medicine's an enormous amount of information you need to have. So how did you go about, I guess, getting more efficient or managing your time differently? Was there something specific that you did?
There was a few things I did. Like I said, with the cases, it was hard because it would ask a question like, I don't know if it was, like I said, a cardiology type of case, and it would ask a question like specific about the symptoms. And you could go on, like your answer to that question could be 2 pages long if you want it to be. So I'm like the date, I'm on like Merck Manual, Toronto Notes, like using every single, I think I had 12 resources at the start. So the best thing for me was to really condense what resources I was using instead of looking in 12 different spots, find the ones that I really liked that I found had the information that made sense to me, accurate, up-to-date information. And then also realizing with these cases for medical foundations, like a 2-page answer, you're never going to remember. That's not actually going to be applicable for medicine. So it was in my head, like, what is going to actually be applicable for me in practice? How do I condense this and make it make sense for me, but also so that I like know that I'll remember it, kind of thing. And then the biggest thing was like really condensing those resources and figuring out what worked for me. So I think that's how I did it. And then also putting a limit on, you can't spend 7 hours on a case. Like I had to like time it for myself and be like, whatever I could get done in those 3 hours that I have allocated for that, then that's what I'm going to get done.
Yeah, that makes sense. First year and second year are completely different in terms of applying everything that you know. So what was challenging about clerkship?
There's lots of things, of course, that are challenging about clerkship, but for me, it was such a breath of fresh air. Like I really loved being able to apply what I learned in second year or in first year to second year. I think the biggest challenge, again, generally as a PA, is lifestyle changes. We don't know our schedule like whatsoever. And it was probably the same for you. I would start a new rotation tomorrow and I wouldn't even know what hour. I'm like waiting by my phone. When do I go in at 4 a.m.? Am I even working tomorrow? Like trying to figure out my schedule. So I couldn't plan anything, which was fine. I knew even going to PA school, like my social life was going to take a toll and there were some things I would have to sacrifice, but I did not know my schedule at all. Even really sometimes where I was going to be for rotations. We had to do a couple rural rotations as part of Dalhousie. So even like in the summer, I was like, am I going to be in the valley? Am I going to be at home? That kind of thing. So lifestyle planning was like thrown out the door. And then as far as specific to Nova Scotia, like I said, this is such a new profession that we were really the first face of a PA that anyone had seen. So I felt a lot of pressure in that. Like I said, I was excited to be an advocate, but I felt a lot of pressure to show such a good face all the time and like really prove myself. And there was a lot of like advocacy, which when you're tired and I'm explaining again what a PA is, I'm explaining again what a PA is. And like, I think I did a good job every time, but it was getting tiring.
Really perfecting that PA elevator pitch can be challenging. So when I was going through, I also had a lot of people that it's the first time they ever worked with a PA student, much less a PA. And I found that some placements treated me like a med student, like a med clerk, and that seemed to be the easiest way. Others were not certain. And again, the PA name is a bit of a misnomer. Some people think you're more administrative, which is not the case. It's all clinical work and seeing patients. Now, one thing I wanted to ask was, is it possible to work part-time during the PA program?
That's a good question. Some people did it. I, for myself, was not an option. I was on a leave of the position that I was previously doing. So they did tell me, like, you can come back if you want work a couple hours here and there. It was just not feasible for me. I was using all of my brain power. So anytime I wanted to make sure I actually got sleep and I actually got to exercise, those kind of things. So it didn't make sense for me. I think for some people, they did end up working maybe the weekends. In second year, definitely not. There's just so many extra hours you have to work and weekends. But maybe in first year, I think a couple people like picked up the odd shift. But I would find that too much, I think.
So in terms of where you did your placements, were they at the big hospitals? Were they at smaller clinics? And do you mind sharing what cities or areas that you did the rural rotations at?
Yeah, going into clerkship, you talk to medical students or other PAs from other areas, and they always say they're rural rotations. You're going to learn so much. You're going to get to do everything. But then in your mind, you're also like, yeah, but the city's my home, and I don't really want to leave for months on end to be rural. So you're like battling of like where you want to be. Like I said, with Dalhousie, you had to do at least 2 rotations, I think, in a rural setting. So most of mine were in the city, a lot of them at the QE2 hospital I was talking about, which is the main hospital here, or just across the bridge, which isn't far, in Dartmouth. Then as far as family clinics, mine was in the city. For pediatrics and obstetrics and gynecology, same thing. It had to be in the city because that's where all like the core of all that is. But then for my surgery rotation and internal medicine, and then also emergency, I did them rural. So I was in the Valley at the Valley Regional Hospital in Kentville here in Nova Scotia for surgery, actually. And then I enjoyed it so much and the team there. And I was just being given so much opportunity hands-on, just like everyone tells you, like you're the only learner. There was only one other resident. There was no other students. So I was never like, I was scrubbing into every single surgery. I was like hands-on, really engaged. So after that, I actually reached out to the program saying, is there any chance I can stay and do my internal medicine here? I love it at this hospital. And I've met the team because it's such a small little hospital. You meet everyone and they're like excited to have me. So it worked out and I did that there as well. And same thing, they were just so good at involving me in everything they could. So the things people tell you as far as rural being excellent, I now can agree, support.
Yeah. Wonderful. And what are your plans now that you've completed the PA program? Because you would have just finished how long ago?
I just finished at the end of the year 2025. So in December, we wrapped up, we wrote our final exams. And then in Nova Scotia, you can get a provisional license, which allows you to practice until you get PAC. Like you write the PAC exam and get certified. So over January, February, was like figuring out that license, getting all that paperwork and everything set up. And I start my position at a family medicine clinic on Monday, actually, close to home. Yeah.
That's wonderful.
So I'm excited, yeah.
Do you feel like the PA program provided you a solid foundation for which to start practice as a PA?
I definitely do. I think the biggest thing it taught me, as I was saying earlier, is to be comfortable in the uncomfortable and understand that you're not going to know absolutely everything. Medicine is such a huge field. So just being confident in what I think that kind of clicked for me in second year. So much of all these like things I was cramming and all these lectures I was reading or like flashcards I was doing, it didn't feel real until it starts to actually click and you're like, wow, I actually do understand a lot of this stuff. I did retain a lot of this stuff. So as far as like physical exam, history taking, coming up with a differential diagnosis, I feel really confident in that. And I also understand that, like I said, I'm not going to know absolutely everything. So I know where to go, like what my resources are. I feel like I'm going to be supported by this team that I'm starting with on Monday. And I'm never going to be expected to be put or allow myself to be put in a situation where I don't feel comfortable. So I definitely feel like it prepared me to just have a good connection with patients as well and do a lot of that patient facing with all that like practice OSCE and then all of second year like seeing patients. It helped me that way and helped me really understand what resources to lean on and what to use like when I need it kind of thing.
And I also wanted to ask, so I'm sure you encountered supervisors and other physicians that have never worked with a PA. So if you were to explain to someone, like a potential employer, what a PA is and what they could offer to the practice, what's your usual spiel or what would you say?
Yeah, it's interesting. I feel like my spiel kind of adjusted depending on who I was talking to. But if it was for a practice that I was trying to work in, I did try to avoid comparing it to other professions because a lot of people you hear say it's very similar to an NP or it's like a doctor, but not. So I tried to stay away from that and just say that we are a very important part of the team. We're really focused on practicing medicine in a collaborative way so we can see patients, take histories, do physical exams, try to get to the bottom of what's bringing someone in and come up with a diagnosis. And we are also able to prescribe medications. And we always have that collaborative relationship with the physician. So if there's any time where we feel we need to consult them or need them involved, they're always there for us. But we're really able to like help provide access for patients and have good relationship with patients in practice and help in so many ways that help with burnout for physicians, help with like so many aspects, like I said, of access to care for patients, especially where in places like Nova Scotia where it's really difficult.
I sometimes I feel like speaking to prospective employers, it's a little bit of a different language because you have to talk about how the business model of a PA makes sense. So there's definitely like non-monetary benefits, quality of life, less burnout, opportunities to focus on other areas of your life, less documentation and less paperwork. But there's also increasing the size of the practice, reducing wait times. And I know that at our surgery practice, at least in the outpatient setting, the addition of a PA actually allowed the surgeon to decrease the time in clinic, triple the number of patients they were seeing without increasing the workload. So there's different metrics and ways that you can do it. And billing can be a little bit tricky. I'm not sure how the system is in Nova Scotia, but it does, I think having a PA certainly makes sense, especially if it's I like to use the term physician extender.
Yeah.
Or we extend medical services, but while also providing quality patient care. So it's an exciting thing to be part of, and I'm excited for you to see the profession grow. I know that you've been through a lot through your pre-PA journey and now having had completed PA school. So do you have any overall lessons you've learned, advice, or encouragement for pre-PAs that are in the throes or in the process of applying now?
I've learned so much throughout the process. And I think, yeah, looking back, if there's certain things that I would really focus on, it's making sure that you choose this profession because you want to be in this profession. Like I said, doing a lot of your research, talking to current PAs, current PA students, to make sure you really understand the profession before going into it, because it was really upsetting to like put yourself through the 2 years of really hard work and then choose not to do it. It's not really the thing to do just because like I want to do a shorter med school. You have to really want to do this profession and be passionate about this profession. I think as far as the most important part of PA school is time management. Try to schedule things in, like even schedule in your self-care, like schedule in your gym sessions, schedule in your social time, because it's so easy to become overwhelmed and burn yourself out like I did at the start. So you can work on your time management, try to put things in a schedule, however that works for you. That's really important. And then again, it's like cliche, everyone says it, but imposter syndrome is real. I still have it to this day. Every single person has it. And I know you're going to feel like everyone around you has it all figured out. They're smarter than you, or they like understanding things better than you, but every single person feels it, and that's okay. And it's okay to reach out for help. I think it's nice now that future classes will have cohorts above them to reach out to and ask for advice, ask for help with resources, that kind of thing. So don't be afraid to ask for help because we've all been there. I think those are the main things. There's so many things I learned, but those would probably be like the key takeaways of advice for people.
Yes. So I'm going to inadvertently age myself here. So back when I was in PA school, we purchased textbooks, we brought our laptops, and I know that things have evolved. So what tools, devices, or apps are you and your classmates using to study?
Yeah. Like I said, I think that was the biggest part for me at the start, just the vast amount of things you could do and trying to figure out your path. It was hard. I think because I did go to school a little while ago, I was so used to like the handwritten notes. So still to this day, I have colored pens where I like write my handwritten notes written out. So my hand's cramping by the end of it. A lot of people in my class had iPads to do the same thing, take notes on their iPad. That's, as far as tools, the main thing was definitely iPads. I have a laptop that I use every day as well. And then as far as apps, resources, I narrowed it down to really liking UpToDate, but as a lot of us know, it can be really in-depth. So it's like you really got to read through a lot of stuff to get to the core of it. So if I'm really trying to understand a concept in depth, UpToDate, I love Toronto Notes and Merck Manual. Those are the ones that I like narrowed it down to at the end as my favorite. And then as far as apps, like of course MDCalc to do all your calculations. In second year, every single person, the med students around you and whatever specialty you're in, the docs will be like, download this app or download that app kind of thing. We have an app here in Nova Scotia, Firstline, that tells us the first-line medications to use for our area. So that was really helpful for me. I think now Dalhousie will be better at having a source of these are the main resources you should use, and that will help you the most because I think that's so important. As far as physical textbooks, I didn't really use any physical books. I was an online girl.
That's good. Yeah, I still have to like print out papers in order to annotate them. I can't, it's difficult for me to do that on an iPad or a screen. Just again, a generational thing. So I'm so glad I got to get to know you and learn more about the Dalhousie program. I think there's so many parallels with some of the pros and cons and challenges that come with being part of some of the first classes. I was part of the second class for McMaster's PA program. So everything you were saying about clerkship, I'm like, oh my God, that was me too.
That's interesting. I didn't even think about that, but that makes a lot of sense that, yeah, you would have had a lot of the same problems and challenges. Yeah.
But it certainly evolved since that time. I don't even introduce myself. I do introduce myself as a PA, but I'm not explaining it as often. A lot of PA students are having PAs as clinical preceptors as they establish more graduates. So I'm sure the same thing is going to happen in Nova Scotia as well.
Yeah, I'm excited for that to happen. I'm excited for it to expand. And I will just say, even being the first class, there was a lot of advocacy we had to do in explaining our role, but the patients and the healthcare practitioners that I encountered were so excited. Like, it really validated everything. Like, they were so excited, really open and welcoming of a PA. So I think that's a really positive thing, and hopefully that just continues to grow.
Awesome. Yeah, thank you so much for your time, Allie.
Thank you. It was nice to meet you.
And that's a wrap. Today you heard Allie's journey from undergrad uncertainty to becoming part of Dalhousie's inaugural MPAS class. She shared how she researched multiple healthcare careers before realizing she checked every box, why lateral mobility and patient-facing medicine mattered to her, and how intentional reflection shaped her decision. We also talked about Dalhousie admissions, GPA realities, MMI prep, as well as her experience in Dalhousie's PA program. If you want to connect with Allie directly, her email can be found in the show notes. You can also learn more about the program through the official Dalhousie MPAS program website, which we've also linked in the show notes below. If this episode was helpful, subscribe to the Canadian PA podcast so you don't miss any upcoming conversations with students and PA graduates across Canada. I'll see you in the next episode.